Hey, Dr. Tyler Williams at Pinecrest. Thanks for checking out this video today. You're here because you don't like to go to the dentist. You're not alone. There are many people who do not like to go to the dentist. In fact, some studies say it's up there as high as public speaking or severe illness, fear of going to the dentist, or the dislike is there and it's real. And, I've heard that so many times in the past 13, 14 years that doesn't even faze me now. But at the beginning, you kind of thought, man, maybe someone doesn't like this thing. But over time, we've learned that's a conscious or subconscious response that a lot of people have because of prior bad experience or, let's face it, you're getting dental work done, someone's kind of in your personal space, right? Literally in your face. And many people hate the dentist or fear to go to the dentist. We've learned some things to make it a lot more comfortable. And what I want to cover in this video is 5 things that may be keeping you from the dentist and some ways you can work around it. The first one is fear or anxiety, which I mentioned is a big part of why many people don't go to the dentist. They're scared or they get nervous or tense or you get that white knuckle feeling when you start cleaning your hand rest. Maybe you hate the needle or you hate sounds in your mouth. And I don't blame you. I remember a couple experiences as a kid where I was terrified of the dentist. And the only good thing that came out of that was I was really good at brushing and flossing for a span of years as a kid because of what I've gone through. That's the first one, is fear and anxiety. The second one is shame, right? You might be shameful or embarrassed. You might be looking at your smile and saying, I don't like how it looks and I'm embarrassed to smile or talk to somebody about it. You want to find someone to work with who is judgment-free and you can feel comfortable and you're going to get a one-on-one consultation and find the right fit for you, not something that's a one-size-fits-all. There are a lot of places and clinics that kind of are a one-size-fits-all. And it's important that all of your health is taken into consideration, right? What are your long-term health goals? What are your diet and exercise goals? What are different medical conditions you're going through? So don't be embarrassed, don't be shameful. Just find someone who you feel comfortable with, sitting down and talking with, and that will listen. And one-on-one, you're in a room, you know a number, you're not in and out as quick as possible. That's not going to get you what you're looking for. So that's the second one, is shame or embarrassment. The third one is cost, right? And for most of us, it's because we got a surprise bill later, or we weren't clear on the finances and surprise. And our philosophy is surprises should be saved for birthdays and Christmas, not for the experience at the dentist. And so work with someone where they're transparent, that up front they give you a cost always before you start treatment, so you can have an idea. Things change. Dentistry is in part, but it's also a science, and the science part of it is not always 100% fixed. Sometimes we get into teeth, implants, or giving someone a new smile, and things are even worse than what we can see on an x-ray, and so we have to prepare and plan for that. But for the most part, you want to work with someone that has enough experience that you feel confident, you know what they're going to do, and that they're upfront transparent about the cost, and also that they offer payment plans. Insurance rarely, if ever, covers everything you need. They cover the basics, like taking your teeth out and using your x-ray. But dental insurance is not medical insurance, it's not fire insurance, it's not designed to give you the smile you've always wanted. So you can also look into things like practice savings plans and membership plans. That's a big part of what we do. Is we have something called the Pinecrest Smile Club, and that's allowed our patients to get better and faster and more convenient treatment the way they want without the restrictions and hoops of insurance. That doesn't mean insurance is bad. It's still insurance friendly. And we even have some supplemental options if you have insurance and some payment plans as well. So make sure you know the costs up front and transparent. You know what the plan is. Right? The fourth one is comfort options. So now there are more comfort options than ever. This would include laughing gas, which you may or may not have had before, or you can take it up a notch to sedation. Sedation are some pills that you take that make you very sleepy, kind of like a muscle relaxer. Our patients love it because you'll predict 75 to 100% of what happens, but it's very safe if you're not put out the way you would be with hospital general anesthesia. Right? But when you think about what happened the day after, you won't remember what happened. because it's all gone, which is nice. And then also it helps relax the jaw. So you're just comfortable and relaxed. You turn the lights out, put some headphones on, so you can just be calm. You know, it's really nice. But patients come back and say, I wish I knew about this 20, 30 years ago, because everything I've gone through with one or two people is miserable. And now I came in to see you and give my whole mouth, and I don't remember anything. And I have a smile on everyone, and that's a lot of fun for us. If you'd like to see some examples of that, you can check out some of our other videos with some of our smiles and steps for how they did it and what they went through. The next one, as far as not avoiding the dentist, okay, is get on preventative plan. But this doesn't mean you need to get all your teeth fixed at once, even though that may be what you want. It just means that you have a plan and a time frame and coming in for maintenance, because the kind of office you want to work with is not just doing a quick cleaning of your teeth, a quick check of your teeth. Or we've all had an experience where the doctor comes in, spends about 30 seconds and says, yep, everything looks fine. Right? Nope, you got cavities. Right? Or, nope, you need to go to surgery. Right? And then you hear all these questions. Why, how, what. You want to make sure the team spends time with you, even though the doctor probably can spend a full hour with you. You want to feel comfortable that your questions are answered and with the resources to make the right decision for your care. And then, of course, doing the things that you're supposed to do at home. And so the fifth one is the more you do at home, the more you can avoid the dentist. And if you have things like sleep apnea, or you take medications that cause dry mouth, you have sinus or allergy issues and your mouth dry, if you have things like diabetes and high blood pressure, it puts you at risk for dental conditions. So unfortunately, brushing and flossing alone are no longer enough. Right? Many people don't floss, and if that's you, that's okay. Just start flossing a few more days a week. It's about the progress, not being perfect, and that'll get you into a healthier space. But also, you probably want to discuss things like things that can help your saliva be more healthy. We do a saliva test analysis in our office, so we can see how healthy or unhealthy your saliva is, and we can provide some things that might improve that for you. But untreated sleep apnea is a good example where you want to talk with the dental team and understand how sleep apnea ties into the health of your mouth and how it can get into harm your teeth. So if you have some more questions on this, please reach out. Our number is below. We have some great resources and booklets and books we've published that can answer more of these questions. So look forward to seeing you on the next video.